Welcome to the Detroit-Wayne County Community Mental Health Agency, a division of Wayne County Department of Health and Human Services. The Detroit-Wayne County Community Mental Health Agency provides services to a growing population of over 60,000 Wayne County consumers with serious emotional disturbances, serious mental illnesses, developmental disabilities, and/or substance use and co-occurring disorders. Our agency offers a culturally diverse network of community mental health programs, clinics, private therapists, psychologists, and psychiatrists to provide mental health services. Services are provided in coordination and collaboration with over 80 contractors, including managers of comprehensive provider networks, often referred to as MCPNs. A listing of these provider networks may be found in our Service Provider Directory and Consumer Handbook. Our agency is also affiliated with several hospitals throughout Wayne County. These hospitals are listed in your Consumer Handbook. We are committed to leading and supporting a community system that provides and manages an array of supports, services, care, and treatments that honor choice and advances the quality of community life. Through the agency's contractual agreement with the Michigan Department of Community Health, the agency provides a comprehensive array of behavioral health specialties and support services. A detailed listing of these services may be found in your Consumer Handbook and Service Provider Directory. If you are a Medicaid beneficiary and have a serious mental illness, a serious emotional disturbance, a developmental disability, substance use, and/or co-occurring disorder, you may be eligible for some of the mental health specialty supports and services listed in your handbook. Before services can be started, you will take part, if you haven't already, in an assessment to find out if you're eligible for services. The assessment process will also identify the services that can best meet your needs. Please note that not all services are available to everyone we serve. If a service doesn't meet your needs, your community mental health provider may not be able to pay for it. Likewise, Medicaid may not be able to pay for services that are available to you from other resources in the community. You have choices as to who you would like to provide your care. At the time of your intake assessment and eligibility has been established, the agency's Access Center will assist you with selecting a conveniently located provider from a choice of 2 managers of comprehensive provider networks, often referred to as MCPNs, that address mental illness. They are CareLink Network and Gateway Community Health. There are 3 managers of comprehensive provider networks that address developmental disabilities: Consumer Link Network, Community Living Services, or Synergy Partners LLC. There are 2 substance abuse coordinating agencies: Southeast Michigan Community Alliance, SEMCA, and Bureau of Substance Abuse Prevention, Treatment, and Recovery. If in the future you would like to change providers, please contact your MCPN or the Detroit-Wayne County Community Mental Health Agency Access Center. If you have an emergency, you should seek help right away. Emergency services are available at any time, 24 hours a day, 7 days a week, without prior authorization for payment of care. Please refer to your Consumer Handbook for the emergency service locations. You also have the option of using the 911 emergency service. Now let's talk about person-centered planning. This is a service designed specifically to address your needs. During the person-centered planning process, you will be assisted in deciding which services are medically necessary for you in the sufficient amount, scope, and duration required to achieve your goals stated in your individual plan of service. The person-centered planning process is your right and is also the time to establish the goals and outcomes you want to achieve. It is also the opportune time to document your desires for your psychiatric advance directives, crisis plan, and/or self-determination directives. Should there be a time when you are unable to speak for yourself, your advance directive will already be in place. To learn more about this very important part of your treatment process, please refer to your Consumer Handbook. The state of Michigan requires that recipients of mental health services are made aware of their rights. These rights are listed in your Consumer Handbook and Service Provider Directory. They are listed under recipient rights and your rights as an enrollee. Every person who receives public mental health services has certain rights. The Michigan Mental Health Code protects those rights. They include the right to be free from abuse and neglect, the right to confidentiality, the right to be treated with dignity and respect, the right to treatment suited to condition, and the right to a safe, sanitary, and humane treatment environment. For more information, you can also call the Office of Recipient Rights at 1-888-339-5595, or for the hearing and speech impaired, 1-888-339-5588, or our Access Center at 1-800-241-4949. Your satisfaction is very important to us. Our customer service unit is available to assist you with understanding the grievance, recipient rights, and appeals process. Please refer to the Consumer Handbook and brochures for more information on these topics. We promote initiatives that support keeping you healthy. Studies have shown that there is a link between physical and mental health wellness. We can assist you with information on programs that are designed to adopt healthier lifestyles in managing health problems that lead to a more productive life. Mental health recovery and living a self-determined life is a journey of healing and transformation, which enables a person to live a meaningful life in a community of choice while striving to achieve one's potential. Our agency promotes programs and support systems that are evidence-based and will allow you to succeed in your transformation. Some of these programs and/or support systems are Clubhouses, a restorative environment for people who have had their lives disrupted by the effects of mental illness and share in the support of others who believe recovery is possible.
نعم كنت أشعر بالخوف.
Before started coming to the clubhouse, she was feeling like with who that she is going to meet, how the staff is going to treat her. She was really like terrified coming to the clubhouse. But after that, when she came here, she saw the members, how they are welcoming, the staff is treating her very well. Now she is much better.
Drop-in centers, facilities that provide informal, supportive environments that assist mental health beneficiaries with their recovery process. Peer support, an evidence-based model of care which utilizes trained peer support specialists to assist individuals with their recovery and self-determination goals. The Wellness Recovery Action Plan, or WRAP, a system for monitoring, reducing, and eliminating uncomfortable or dangerous physical and emotional difficulties by utilizing self-help skills. Independent facilitation, the option of selecting a neutral person to assist with the person-centered planning process in order to help an individual to realize his or her desires and needs. And family subsidy. This program is designed to provide financial help for families who are caring for disabled children who are 17 years old or younger in the family home. As a consumer or family member of a consumer, it is important to become involved with the design, delivery, and evaluation of the agency system. If you are interested in becoming an advocate or participant in focus groups and/or agency-related committees, please give our customer service unit a call at 1-888-490-9698. Customer service can also provide you with a schedule of monthly events. We believe in keeping you informed. Various forms and literature that you are entitled to receive will help you understand your services and rights. Most literature will be provided to you during your enrollee orientation and at least annually thereafter. To request additional copies, please contact the Detroit-Wayne County Community Mental Health Agency Access Center. The educational materials you receive are available in alternative languages if you need them, at no additional cost to you. There are some important phone numbers that you should find helpful navigating through the agency's mental health system. These numbers are listed in your Consumer Handbook, Service Provider Directory, and on the back cover of the agency's brochures. You'll also find these important numbers on the Wayne County website at www.waynecounty.com under Health and Human Services. In your informational materials, you will be provided with a list of important phone numbers that you should take note of and place in a convenient and accessible location. These numbers are the Access Center for information, referrals, and eligibility determination, 1-800-241-4949. The agency's customer service for consumer affairs, community outreach, and education, 1-888-490-9698. For the hearing and speech impaired, 1-800-630-1044. The Office of Recipient Rights for filing of complaints regarding violation of your rights, 1-888-339-5595, or for the hearing and speech impaired, 1-888-339-5588. Here are some frequently asked questions you might be interested in. How do I get an appointment for mental health services? You may contact the agency's Access Center listed in your consumer handbook to find out if you're eligible for services. How do I change my Manager of Comprehensive Provider Network, or MCPN, or provider? You can request an enrollment form from the Access Center to change your MCPN, complete it, and return it to the agency's Access Center. You may request a change of provider from your MCPN. What determines my eligibility? Your eligibility for services is determined at intake by a clinician. We are committed to providing you with the best care, guaranteeing your rights, and improving your life. Our goal is to exceed your expectations.
15 years ago, my life was devastated. Now I have hope, I have promise, and I have a future.
I was kind of scared, I was skeptic, pretty nervous about what happens around here, because I've never come here before. But after I came here, it wasn't as scary. It wasn't nothing wrong with it. It was a very nice place. Everybody's very welcome in here, actually. They're very nice people.
I came here and it was like, wow. The staff and the members were so nice, and I felt like I had a purpose. I actually felt like getting up in the morning.
Through the treatment here, she felt that her life has been changed 180%.
I'm learning how to become more of a man that can take care of his own self.
I'm getting excellent care because the doctors see to my needs, mentally and physically.
It was tough, laying straight and all my business, but it was worth it in the long run.
It's okay to cry, and it's okay to ask for help, because if you ask for help, you'll get it.
I've been extremely happy with the quality of care. Jessica comes out to visit. At first he was a little shy, but now he's doing really good. He's happy to see her, excited to see her. They're fully engaged when he's there. We do different little projects.
The stigma definitely was there for me. We talked about people that took medication, psychotropic drugs, and we laughed at them. And so I ran from a diagnosis. Early on, I had been diagnosed as emotionally disturbed with homicidal and suicidal tendencies, but I refused to accept the diagnosis, and I ended up suffering for quite a while. But then again, when I did, was helped to understand that it is an illness. It doesn't mean I'm crazy if I got help for it. And so I went, got help for it, and I've been stable since.
I was definitely treated with respect. I have no complaints whatsoever. It probably, I'd recommend it to anybody seeking help.
I came here. I like my job. I come here all the time, Henry Ford, and I got friends.
I really like working here and working at Henry Ford, picking up the garbage 3 days a week. We've been there for 10 years.
Monday from Friday, and work here Tuesdays and Thursdays here. Go volunteer like for food bank or Meals on Wheels.
If I didn't have an opportunity, I would be in a nursing home.
Without that treatment, I might be back on the street. I think so. I know so. Because I stayed out there for 2 years and everything went wrong.
My children, my wife and I, have now found stability now. We don't feel at risk like we used to, and I don't have to be confused and worried all the time anymore.
Go-Getters is like an extended family for me. You can't imagine how much it means to be able to get up at least 4 mornings in the week and have somewhere to go.
I'm the only child. I have no brothers, no sisters. I have no children, no ex-wife, none of that. And so after my parents left, then I lost my girlfriend, and my dog left me too. And then I lost the house. And they located me in a very nice, clean apartment. Everything's relatively new or brand new. And I see, the thing is, the little work that I do here is nothing compared to all the help that I'm getting. Help that I didn't expect to get. You know, some things I knew they were going to do, but they're way, over and beyond the call of duty. That's what they do here.
Sirvió mucho y es una experiencia que nunca se me va a olvidar.
Okay, he says that they treated him with a lot of respect, that they treated him well, and he says they opened up his mind and taught him to look at things differently, and it's an experience that he's never going to forget.
When I come over, we do a lot of things together.
First thing is, I have never allowed him just to sit and be at home doing nothing. To me, that's a road to vegetation, and I don't think that's proper for individuals that have developmental disabilities or mental illnesses. They need to be out in the community doing something to assist in their progress.
I was very grateful of how personal it was when we did go in for the original evaluation through the Guidance Center. I mean, I was scared at first, hoping and praying that, you know, we were really going to get the help that we needed. And we did. It was very personal. It was very, I loved going there and sitting down with each and every one of the therapists, and they know my son. They know what just triggered that. They know how to help, you know, try to prevent things from happening, and they were absolutely wonderful. They really hit on what Michael needed, what I needed, what Katerina needed, what we all needed as a family.
Thank you for watching this video and for choosing the Detroit-Wayne County Community Mental Health Agency to provide your care. If you have any questions or need help in any way, please contact the Detroit-Wayne County Community Mental Health Agency Access Center. Have a great day.